So before we speak with our panelists today, I'd like to walk through a few caring reminders. Suicide is very personal and can be an emotional topic to discuss. Many of us are survivors who miss our friends, relatives, and neighbors. Some may be attempt survivors or may be thinking about suicide. And if you are thinking about suicide, please reach out. Based on what you learned today, please do not hold yourself responsible for something you didn't do or say in the past. And please check in with each other and take care of each other during this presentation and afterwards. As always, please refrain from using a Zoom background of the Golden Gate Bridge and allyship of those who have lost loved ones by the bridge. Let's keep here what is shared and respect confidentiality for all who are here today, but please take away what you've learned. This meeting is being recorded, but will stop during our community discussion. And after the meeting, as always, you are invited to join us during our lobby lounge. And for those who are now joining us, again, our speakers today are Danielle Glorioso, Scott Ostendorf, Gwinnetta Cook-Huddleston, and Ingrid Valdez. And I will continue to admit people into our meeting as we get our meeting off the ground. So the purpose of today's meeting is to discuss grief, sudden loss, and the possibility of hope. We have a wonderful group of presenters and panelists who will discuss their experience around grief and how to support young people and adults in our community. While there are different types of grief and sudden loss, and secondary loss, we won't be able to address it all today. However, we hope that in talking about grief, we can create the beginning of shared understanding, support one another, and plant seeds of hope on our path. As a reminder, November 18th, we will be hosting International Survivors of Suicide Loss Day, and we'll talk a little bit more about that at the end of our meeting. I'm going to now introduce Danielle Glorioso, who will speak with us from a national perspective and her expertise. Thank you, Danielle.
Thank you so much. And thank you all for having me here today. I'm going to go ahead and share screen. Okay, can you all see that? Okay, great. Well, again, thank you so much for having me here today. My name is Danielle Glorioso, and I'm a licensed clinical social worker based in San Diego, California. I have a position at UC San Diego, and I also have a position at Columbia University School of Social Work in the Center for Prolonged Grief. And I'm going to be talking to you today about an overview of grief, prolonged grief, and suicide loss. So I always like to start my talks with an image like this, because for those of us who work with grievers or who are grievers, what we know is that having support and someone who can bear witness to our journey is so critical in moving through the mourning process and integrating a loss. And so as a prolonged grief disorder therapist and a grief therapist, I feel as though my highest honor is to sit and bear witness to someone's pain and someone's healing. And I think that's an important piece to highlight here as we get started. But I really want to highlight before we move on the real reason why I'm here, which is my brother, Brian, that I lost just over 16 years ago to suicide. And it has forever changed my life. And so first and foremost, I am a suicide loss survivor first and therapist second. And so everything that I do in my work is informed first by my own experiences with suicide loss and then with my own professional training. And so I'd like to make sure that he is mentioned and highlighted in everything I do, because he really is the heart and soul of the work that I do. So it's in great honor of my brother. So today I'm going to be covering acute grief, integrated grief, suicide loss, prolonged grief disorder, and prolonged grief disorder therapy. So that's a lot. I'm from the East Coast, so I talk fast. So I will try my best to not go too quickly, but also be sure to cover each of these pieces on a very sort of high level 30,000 foot view. So Grief is universal, but how we understand it is not. So if you go and do a Google search and type in what is grief, you will be so surprised, or maybe not, at all the various pieces that will come up. There's lots of different ways that people conceptualize grief, view grief. And so I will just share that everything that I will be presenting today is through my training and work with the Center for Prolonged Grief, and how we see grief and loss, and how we see acute grief and integration. But if you do a Google search, you will find lots of different ideas and definitions around grief, which can sometimes be daunting for grievers and those of us who also want to support grievers. So grief, as we know it, whether it's usual or prolonged grief, is a response to an experience of loss. And so today I'll be talking about the loss to somebody that we love to death. But certainly grief can be related to the loss of a marriage, the loss of a job, the loss of anything that we hold dear can create grief and acute symptoms related to that. But grief is really more than just an emotion. It's a collection of thoughts, feelings, and behaviors. And I like to say that it is like a thumbprint. There are no two that are exactly alike in terms of the grieving process. So it's unique to everyone and every loss. But of course, there are still common themes and commonalities in how we process loss, but there are no two exactly the same. And it continues indefinitely after a loss. It's really important to note that grief is not something that we're meant to try to get rid of. Grief is something that's forever. What we want to do is learn to manage it and live with it. And of course, for those of you on this call who have grieved a personal loss, you know that it changes over time. It can be one thing today and something very different tomorrow. And for those of us in the beginning stages, it can be minute to minute, hour by hour, it can change. And it does not occur in any predictable way. So the definition that we like to use is grief is a response to loss, right? And so it's a complex experience, and it's the form that love takes when someone dies. And it's permanent, yet ever evolving, universal. Those of us who live long enough will lose someone we love. And it naturally contains mixed feelings and thoughts that can be really complex. And for those of us who are new to grief, it can be very overwhelming to make sense of as we move through the mourning process. But unlike some thoughts, there are no predictable stages. So it's really important to note that there lies nothing about grieving that's linear. And it's not one size fits all, that's for sure. And in fact, you can even say it's a little bit messy, contains a wide range of overwhelming thoughts, feelings, behaviors. It does have some common pause points, like things that can give us some respite. But if you think about the acute phase of grief, which is generally like, you know, from the day we lost somebody for like the next 6 months, it's when things tend to be most acute, most heightened. Thoughts and feelings can be quite erratic, really hard to make sense of, and can be really difficult to manage in the beginning months for sure. And really the way that we see it is when we think about attachment theory and loss. And so as humans, we are biologically hardwired to seek proximity to others, right? So we seek these strong attachments. And when we have these strong attachments, it can create a level of homeostasis within our bodies, right? And so we can be physically connected to people. And when we lose that person, it can cause everything in us to upend, everything. So our internal workings and physiology completely change. And so we will then have difficulty eating, difficulty sleeping. We develop something that many of us have called grief brain, where we can't really think or concentrate well or process information. And so sort of everything in our internal world becomes upended and off tilt. And for many grievers, we don't understand that this is actually a result, a natural result of losing a really important attachment figure, which can impact our ability to like go about the world and explore. And so in time, our hope is that we will find a way to adapt to this new reality and create a sort of new homeostasis from within. And so we like to explain to our clients that the idea and concept behind attachment theory and how this might be impacting their experience of loss. but also thinking about grief as being a stress response, right? So the loss of someone we love is one of the most severe stressors that we can experience in our life. And it can bring about so many challenges. And grief is essentially a stress response to that, right? And so we have a range of stressful things that occur as a result of the loss. We are losing our companionship. We are losing our sense of protection, our sense of self and identity, aspects of our personal and social identity. So if we lost a child, we perhaps lost our view of ourselves as a parent. If we lost a spouse, we now lose our identity as a couple and are no longer maybe feeling like we can identify in couple situations or are no longer invited to couples events. And also a sense of stability can be lost as well, trying to make sense of this new reality without our loved one. And then other restoration related stressors that can occur, right? It's not unusual for challenging family dynamics to come up after a loss of someone. We can be excluded from various social groups, difficulty meeting responsibilities, paying bills, going to our job, and then also just an increased uncertainty about the future. And so the experience of grief adds to the stress as we're going through this experience, right? So the challenges that grievers face is that like our thoughts and feelings don't always make sense. And so we might want to let go of the grief, but also feel like we want to hold on to it. We might want to feel free of this pain, but also tell ourselves that we should have to suffer. Or maybe if we lost a child, we believe that if we were to feel better, what would that say about us as a parent? We might want to sort of move on with aspects and then feel as though that would be really disheartening to do to our loved one. We might find a need to be with other people, but then also feel like we want to isolate. So there's sort of a push-pull that can happen with grievers that can also make the mourning process a little more complicated. We might crave closeness to the person who died, but then think that we need to avoid reminders of the loss. We might want to stop thinking about what we have lost, but also feel frustrated. So there's sort of all of these nuances that can come up and make it challenging as we move through the mourning process. And so I think everybody in this meeting is probably pretty well versed in suicide loss, and the statistics are staggering. But what we know about losing someone to suicide, and I can speak from my own experience, it's a deeply painful and distressing experience. And many of us suicide loss survivors will say that we feel very isolated and alone, which is interesting given the staggering numbers of people who lose someone to suicide. And yet we all very commonly feel very much alone. And so the reality is that they are now estimating that with every suicide loss that occurs, each one person leaves behind up to 135 people that are impacted by the loss. And so what that tells us is, and when I go to these American Foundation for Suicide Prevention walks and I see the hundreds and hundreds of people walking there, I'm aware that there are so many people out there suffering and needing a place to bring their pain and their thoughts about the complexities related to losing someone by suicide. And so what are some of the characteristics of suicide loss, and some of the ways in which losing someone by suicide could be sort of a little more complicated to work through, is that many of us grievers feel as though our loss is different than others. And it's not that we feel as though our pain is more severe than other types of loss. It's just that we have these additional layers that complicate the grieving process that we have to work through that perhaps other types of losses don't have. So for example, we call these derailers. So for example, when we lose someone by suicide, we have a need to make sense of it. If we lose somebody to cancer, it's difficult, it's painful, but like intellectually, that type of loss can make sense to us. But a suicide loss does not always make sense. We feel the need to do detective work. We will look through every email, every voicemail, every paperwork that we have. We will try to put every piece of the puzzle together, and we'll play on it over and over and over again. The last phone call, the last conversation, trying to make sense of something. We often find ways to blame ourselves and feel really guilty about the loss. For some of us, I did not experience this, but for some suicide loss survivors, there's some shame in losing someone to suicide. I've worked with many clients who lost their spouse to suicide, and they feel as though their community thinks that there was something wrong with them, that their spouse would take their own life. When a child loses a parent to suicide, sometimes there's this feeling that like it was my fault. And so there's some shame around that piece too that people might carry. And of course, losing your parent to suicide might also leave you with the struggle of rejection and abandonment. And then there's also trauma associated with a suicide loss, those of us who found our loved one. So these are aspects that are additional layers that suicide loss survivors have to work through during the grieving process and can get in the way of our ability to move from an acute phase of grief to a more integrated phase of grief. And so because of that, it has been found that suicide loss survivors are at a higher risk of developing prolonged grief disorder, major depressive disorder, post-traumatic stress, and suicide. So what are some of the realities of sort of when grief is transformed and integrated? So again, as a grief therapist, I want to help my clients learn to manage the grief and integrate it into their lives. And so what does integration look like? It looks like finding a place in our life where we can accept the reality of what is. It doesn't mean we like the reality of what is. I will never like the reality that my brother has passed away. But I have come to terms with that reality. I feel more physically re-regulated. Thoughts and memories are no longer a dagger to one's heart. They perhaps are bittersweet. And emotions become more bittersweet, more regulated, and we are able to reconnect with others and re-engage in our life. So it's really important to know that even when it's integrated, grief is not always quiet. So as a grief therapist, we want to let people know, again, our job is to not make grief become quiet and dormant. It's just to find a way to understand our grief and learn to manage it. And I have just a few more slides. So what happens when we don't integrate grief? Something called prolonged grief disorder emerges. And so some of you may be aware of what prolonged grief disorder is, but sadly, there are so many people, roughly anywhere between 7 and 12% of grievers develop something called prolonged grief. And most of them have no idea that there's a name for what they're struggling with. And so prolonged grief disorder actually recently entered into the DSM. So we're just thrilled about that. Those of us who have been studying this for a long time feel as though we can now help more people. But essentially, prolonged grief disorder, for those of you who are not too familiar, happens when we lose someone close and we experience intense yearning and longing and preoccupation with the loved one that we lost. And it lasts longer than social norms. So for example, if you lose someone you love and say 5, 10, I've seen people even 17, 18 years later are still really in an acute heightened state of grieving all these years later, that they're really having difficulty, engaging in their life, doing anything meaningful to them, enjoying life. They are like, their grieving process has gotten derailed and they say stuck, spinning on the side of the grieving track all these years later. So symptoms would be identity disruption, marked sense of disbelief about the death, all those years later, still unable to come to terms with it, avoiding reminders. So years later, still not driving by certain things that might remind you of your loved one, really still intense emotional pain. And in fact, those with prolonged grief, the adage of like time heals all wounds does not apply. In fact, as time goes on, it actually gets harder and harder because statutes of limitations may have gone, our support system is no longer understanding. So as time moves on, it actually becomes even harder. So prolonged grief is something that is more common than you would think. So what are the risk factors? Things that might contribute to those developing prolonged grief? Well, we don't exactly know why some develop prolonged grief and others don't. There's been plenty of research around this, but we know that there are some things that tend to be risk factors. So if you have a past history of depression, trauma, difficult relationships, and difficult attachment styles. If you had a challenged relationship with the loved one, we know that circumstances of the death can contribute. So how they died. So we know suicide loss, homicides, and other violent deaths tend to be risk factors. And also some other context for grief, like, challenges in your life, transitions in your life, loss of income, that kind of thing. But the real reasons we can't always know. But the good news is there is a highly, highly effective form of therapy for prolonged grief disorder. And I just have one more slide after this. And this is a short-term 16-week therapy developed through Dr. Kathy Shear, who leads the Center for Prolonged Grief at Columbia. And it's a 16-week session delivered, and the research shows that over 70% of those who do this therapy have a marked increase in their functioning. And as somebody who's been doing this work as a prolonged grief disorder therapist for over 10 years, I can tell you it has transformed the lives of just about everybody I've ever worked with. And so if you want to learn more about this, you can go to Columbia's website. And we basically, the therapy is designed to help facilitate the process of adaptation to the loss. And we do that through healing milestones that are listed here, helping our clients understand and manage grief, managing emotions, seeing a promising future, strengthening relationships. All of these areas are generally ones that grievers can struggle with. And my last slide, we work on goals with clients too, helping them get re-engaged in their life and get excited about their life. And get them some joy and satisfaction back. So with that, I know I said a lot. I know I covered a lot. I know I talked really fast, but I do appreciate your attention. If you have any questions, feel free to reach out to me at any time.
Thank you very much, Danielle. We will be having a community discussion at the end, so please take note of your questions. I'd like to now pass it over to Scott Ostendorf, who will focus on youth grief and how we can best support young people when there's a sudden loss in our community. Thank you, Scott.
Thank you, Kara. Now I can see you all. Thank you so much. Good morning, good afternoon, everyone. I'm Scott Ostendorf. I'm with the Marin County Office of Education. I'm a licensed marriage and family therapist, and I've been working in Bay Area schools for approximately the last 20 years, supporting students in mental health services across different school sites. So today I'm going to speak to you about supporting youth while they may be experiencing grief. So let me get to my next slide here. So talking a little bit about grief symptoms and trauma symptoms. Trauma symptoms, in addition to grief, often occur when there is a death or a loss that was sudden and unexpected. And often with suicide, we are talking about unexpected losses. So some of the symptoms to watch for may be intrusive thoughts. These are things that people may experience, such as flashbacks, having involuntary memories, or even frightening dreams. Also, it's common that there may be experiences of avoidance, where the individual is trying to avoid any reminders or thoughts or memories of the person that they have lost. We may also experience hyperarousal, which looks like irritability, perhaps reckless behavior, a hypervigilance, sleep disturbance may be common, as well as having a startle response, so that an individual is startled easily by things that otherwise would not startle them, as well as concentration challenges may be common. And then the final one I'll talk about is hypoarousal. This would look like a feeling of disconnectedness, being numb, spaced out, forgetful, possibly having a lack of interest in things, or an inability to experience pleasure or enjoyment. So all of these may be symptoms that somebody would experience if they're experiencing grief due to a death or sudden loss. So when we're talking about working with children or youth who experience grief, it really might be different depending on the developmental level or the age of the child. So we know that young children may not conceptualize death, and they may not have that ability to understand that death is permanent. They may think that the person is sleeping and is going to come back. And so it may be hard for them to understand that death is permanent. Also, young children may only be able to sustain discussions of those strong emotions or experience those strong emotions for short periods of time, and then they'll need to take a break from that and return to some normal activity of their interest. Some of the things we might look for when a young child is experiencing grief We can look for behavioral difficulties, decreased concentration, perhaps a change in school performance. There may also be regressive behaviors. So a child may have mastered some sort of developed milestone, but as a result of the grief they're experiencing, they regress in their skill levels. We may also see depression, irritability, some withdrawal, and then also somatic complaints. These are physical symptoms they have, such as headaches and stomach aches, that are not due to a physical ailment, but it is a manifestation of the emotional experience that they're having. As we move through the developmental spectrum, adolescents have a better ability to conceptualize death and understand more abstractly the permanency of death. For adolescents, their grief may look more like the mourning with extreme sadness that we as adults may experience as well. We also may see symptoms of denial, regression, or even risk-taking may be part of the grief process for adolescents. And teens are often more willing to talk to their peers and people outside of the family for support. So parents may be a little frustrated or concerned that their child is not speaking to them about their grief, but the child may in fact be talking to their classmates or their friends about it because that's developmentally normal for a teenager. But just like children, adolescents can also only sustain these strong emotions for short periods of time, and then they may need to take a break. They may have difficulty transitioning to other activities or may feel some guilt in going back to doing some of their regular activities, feeling that perhaps they should be grieving in a different way, and it feels odd to them that they would be going back to activities that they may previously enjoyed. So when we look at the teenage years, you can break this down into the young teen years between 12 and 14. At this age, students are often very self-conscious, they may be very private, and they may not necessarily want to talk about their feelings. As students get into the middle teen years, 15 to 16 years of age, there's a tendency to feel more invincible. And at this point, they may use more risky behaviors to cover up those feelings of vulnerability following a loss. Older teens, they tend, because of their age, to grieve more similarly to adults, but they also may have regressed. And so you may see them exhibiting behaviors that are more similar to younger age youth. But they may also be more willing to talk about the philosophical issues around life and death and engage in more discussions that look more like what adults may experience. Grief-related distress for teens can look like depression, maybe anger toward adults, having a short fuse or short-tempered. There may be suicidal thoughts that the youth are starting to experience as part of this grief process. Also, there may be an increase in non-compliant behavior, perhaps some role confusion, especially if they have lost a friend or they've lost a parent. Their role in the family or the friendship network may change. We also may see some academic challenges, changes in grades, not attending school when they should be. And then, of course, risk-taking or other high-risk behaviors that may include substance abuse as well. I do want to say at this point that I think it's important when we think about supporting boys and young men that they may experience greater difficulty sharing emotional experiences. I think I would like to recommend that one strategy I have often used is walking and talking, having conversations while walking so that the young man doesn't feel like he needs to be sitting with me face to face talking about the grief, but it has an opportunity to share where there's not direct face-to-face contact as well. That will help a little bit with the vulnerability they may be experiencing. So how do we support youth who are grieving? Number one, create space for them to talk. Give them an opportunity where they can talk not just about the loss, or they can talk about anything that's important to them, but maintaining and keeping that line of communication open is really important. When we communicate, we want to communicate in honest and direct manners. We want to use really clear language to talk about death and loss, using the words died by suicide, took his or her own life, not using euphemisms around that. It's also important to normalize the experience and the emotions that youth are feeling. What they experience is common, and this is very normal for the circumstances in which they find themselves. It is important, though, to try to have predictability and routine for the student or the child, but allowing for some flexibility. So going back to normal routines, normal activities that they might participate in when they feel ready to do that, but allowing some flexibility, knowing that on a particular day, they may not feel up to it, and the next day they may feel different than that. Also, children also may express a sense of loss of control. So giving them opportunities to make their own choices. Here are a range of activities we could do. Letting them feel like they have some locus of control over their life would be important as well. Encouraging self-care. Going through grief takes a lot of energy. And so it's really important that our youth are taking care of themselves. They're eating well, they're sleeping well, drinking enough water, and participating in activities that bring joy and happiness to them. Also making sure that family members and caregivers are cared for as well, because the mental, physical, and the emotional health of the caregiver has the most influential impact on how children are going to respond to a loss. And so there's a lot of opportunity for adults to model for students how to take care of oneself, and making sure that the adults are also caring for themselves. And also just that we as adults are being aware of our own losses and our relationship with our own grief, that we're making sure that we're taking care of ourselves. So how do we do that? I think it's really important for those of us who are supporting young people, whether we are educators, whether we are parents or family members, that we're practicing self-care as well. You can't pour from an empty cup. We have to take care of ourselves first. And so one of the ways we can do this is making sure we're attending to our physical needs, that we're eating nourishing food, drinking lots of water, getting adequate sleep, exercising, taking a vacation or a break, and just remembering to breathe. It's also important to stay connected to our social networks, whether that be friends or families. Doing something that might be fun or creative would be a good way to take care of ourselves. On the emotional front, we want to make sure that we're making room for those emotions and not trying to suppress the emotions, but allowing them to come up and be experienced. So that means also sometimes finding comforting activities. Do something that might be calming. That can be listening to music. Some people prefer to write in a journal. Join a bereavement support group is another strategy, or talking to a counselor or a spiritual advisor may also be a method for us to take care of ourselves emotionally. For many people, spiritual activities are important. So participating in those activities, that can look like connecting with nature, praying, practicing mindfulness and meditation, or as well as practicing yoga might be a strategy for some people. And then finally, making sure we're getting plenty of rest, get plenty of sleep, take time outs as they're needed, practice relaxation techniques, mindfulness, and really importantly, I think, lowering productivity expectations for ourselves. It's really important. I often say, let's practice self-care, but I think equally important, it can feel a lot of times like, well, now I've got another job, I've got to take care of myself. And so I would say, let's practice self-compassion, that it's okay if we're at work and we're not able to work to 100% that day. That's okay. That's part of the giving ourselves permission to experience the grief and to go through our own experience. Another strategy for self-care is play, making time for fun, laughter, different physical activities, do something you love. And this goes for children as well. Making sure that they know that it's okay for themselves to experience joy and happiness and laughter as well. Sometimes we need to distract ourselves to get our minds off of the experiences we're feeling. So that can be going to a movie, reading a book, playing video games, watching TV. As long as we do things in moderation, they can be helpful coping skills for ourselves. And then the last thing would be connection, calling, getting together with friends, family, joining a group, or spending time with a counselor, but making sure that we're doing things that feel nourishing rather than taxing to us, because we do not need to add additional stress as we're going through these experiences. Okay, thank you. Hope that was helpful, and I'll be around for extra questions and conversation as we proceed.
Thank you very much, Scott. That was very informative. Thank you. I'd like to now introduce Gwinnetta Huddleston and Ingrid Valdez from the Institute on Aging and the Friendship Line, and they'll talk a little bit about grief in the older adult.
Hi, everyone. My name is Gwinnetta Cook Huddleston, and I'm the training supervisor for the Friendship Line at Institute on Aging. And I'm just going to talk to you a little bit about, what older adults face when they're going through grief and loss, which is very different um, when you're older. So I'm going to start off talking about why the reasons for increased risk in older adults facing grief and loss. First of all, it's those life transitions, right? We all go through these life transitions, but for our older adults, they're dealing with the retirement, the relocation, the change in their health, and possibly a death of a loved one. We have to think about older adults' losses are major, and there's many of them, right? In a very short period of time, they're dealing with a lot of losses. Um, we can't dismiss that natural aging process, right? That we're all going through. That also brings on many losses as well as we're going through that transition. Um, and also they no longer live independently, depending on their health, right? So that's a big loss as well. And also loss of close relationships with family members. And this could just be because, their family members are busy, they're living their lives, right? Or it could also be just a changing in living situations, sometimes that empty nest and children getting married and leaving and going off. And we can't ignore the lack of mobility, how that affects them as well, and that affects their freedom. So why do older adults face grief and loss differently than others do? Well, first of all, it's their physical health, at any age, right? But older people are at much higher risk of severe health problems due to their increased stress levels, and also combine that with just their normal health concerns that they're going through, that can put them at higher risk. Um, Also, appetite changes. As we get older, our older adults, they eat less. And if they're grieving on top of that and dealing with that stress, they may be skipping meals. We see a lot of that, people skipping meals and they're not eating or even thinking about, eating and taking care of themselves. Also, confusion is common. I mean, that's common in grief. You're questioning why this happened to you, you're questioning why it happened, and there's a lot of confusion when you're dealing with grief. But for the older person, this can be more intense because you have to also include that they may have some forgetfulness or deorganization, that comes with age. Also, isolation and loneliness, are pervasive issues among older people. So when someone they love dies, that becomes more intense, that loneliness. It's one less person that they have, one less connection, right? So how can we fix this? How can we help our older adults? Well, build a support network. Um, Utilize technology. Technology is so important. I was just invited to a symposium and I got to meet with others in the field, and they were telling me about how they're utilizing technology to connect our older adults with their families and with other people, so they're not lonely and they're not isolated. So we definitely want to use technology. We want our older adults to be able to use the computer, to be able to use their phones and text, their grandchildren if they have someone, or send pictures. That's building connection there. Um, and like the second one says, connect to family and friends. That's all a part of it. And our older adults, they don't know how to utilize technology. Therefore, there's a disconnect there, especially like with their grandchildren. They're probably not going to talk to them very often if they don't know how to text, right? Um, Also, just participating in activities that bring them joy. We want to make sure, you know, our older adults, we're finding things that they enjoy versus, trying to get them to do things that they don't enjoy. Um, and access to resources that can provide emotional support during this time, such as our friendship line, which my colleague will talk about in a moment. Access to appropriate mental health support. I think we kind of tend to forget our seniors when we talk about mental health. They're kind of suffering silently there. But like I spoke about earlier, they're going through a lot of changes all at once, and that can bring on depression. And we're not offering them that mental health support that they need. Also connect them to the community. So important. On the friendship line, we have volunteers that are seniors. So if they have a computer, we do the rest. I'll train them on how to be on the line and offer support to other seniors. So we want to connect our seniors to the community, get them volunteering, or if you're an organization, have them volunteer at your organization. And definitely support them in finding a new life purpose, right? We all need a purpose in life. That's what keeps us going. And sometimes when you're losing people, you're losing your spouse or losing your loved ones, you question what your purpose is. So we definitely want, to help them find that, right? Be a support to them to find that. Thank you. I'm going to now turn it over to my colleague, Ingrid Valdez.
Thank you so much, Gwenetta, and thank you, everyone. My name is Ingrid Valdez. I am the Outreach and Engagement Supervisor at the Friendship Line, and I would like to talk a little bit about the services that we offer. And this is a great segue because we were just talking about how older adults deal with grief. And doing my research on the aging population, approximately 1 in 4 adults, 65 age or older, are socially isolated and feel lonely. I would like to explain a little bit how social isolation and loneliness vary. So social isolation is an objective physical separation from others, whereas loneliness is a subjective feeling or perception that you're being alone. So just because you live with someone doesn't mean that you have somebody to talk to. You may, in fact, be lonely even living with people in your home. I would like to talk a little bit about the Friendship Line, and I will share my screen in just a moment. Can everyone see the screen? Okay, thank you so much. So at the Friendship Line, a brief history about the Friendship Line. It started in 1973 by Dr. Patrick Arbor. Then he joined our Institute on Aging in 1995. And in 2012, we became accredited by the American Association of Suicidology. And as you can see here, the Friendship Line is basically a lifeline of hope. We want to connect to those people who are socially isolated and feel lonely, people who are grieving and don't have anyone to talk to. We offer emotional support, crisis intervention, elder abuse reporting, and information and referrals. This service is available to anyone aged 60 years or older, and adults 18 years and older living with disabilities and their caregivers. We also offer a call-out service. So this is basically checking in and calling, callers on their own time. So if they tell us, I want to receive a phone call at 8 a.m. on Tuesday, we will do that. Our phone calls it's a toll-free service, basically. And it is an accredited 24-hour toll-free crisis intervention hotline that provides emotional support as a warm line for older adults. I have this flyer here. If you have any questions about it, I will stay on the line to answer any questions you may have.
Thank you very much, Ingrid. And just as a reminder, everyone will receive copies of the slides from today's presentation. I'm going to pass it over to Amit right now.
Thanks so much. Thank you to all of you so much. Really